Monteggio's fracture is a fracture of the proximal ulnar shaft associated often with the dislocation of the radial head. It most often occurs due to a fall onto the outstretched hand or in traffic accidents. It occurs most often in children, young males, or elderly females. Its risk factors include osteoporosis, women who are postmenopausal, and sports. Its complications, if diagnosed incorrectly or left untreated, include bone deformity or shortening, pain or instability, nerve injury, muscle stiffness, or wound infection.
Symptoms of Monteggia's fracture/dislocation include swelling around the elbow, forearm, wrist, and occasionally the hand, pain with movement of the elbow in any plane, tenderness in the forearm is common. Also, you have limited wrist and elbow range of motion, and sometimes, and there's an obvious deformity of the forearm, but depending on how severe it is, dictates how the forearm will look. Sometimes, if the ulna fracture is displaced, the forearm will look deformed, but if the ulna has a green stick fracture or plastic bowing, the deformity is mild and the fracture can be missed.
AP and lateral view radiographs are most commonly performed first, but CT scans may be helpful in fractures involving the coronoid process, olecranon, and radial head. If the diagnosis is delayed greater than 2 to 3 weeks, complication rates increase, and most fractures in adults end up being treated surgically because their fractures are open and unstable.
In regards to diagnosis, anterior, posterior, and lateral elbow radiographs are usually sufficient enough for a patient to be diagnosed. Ulnar fractures are more obvious on the x-rays, and radial head dislocations may require more analysis and are usually in the direction of the ulnar fracture, which is how the different types are classified. For example, in the picture on the left, this is classified as a type 1, which is the most common form because the patient has an ulnar fracture and radial head dislocation in the anterior direction. The picture on the right is another example, but this one is type 2 because the ulnar fracture and radial head dislocation are in the posterior direction. A type 3 fracture, which is in the picture on the left, is when the radial head dislocates in the lateral direction. Lastly, a type 4 is less common and occurs when both the ulna and the radius are fractured in the shaft, as well as having the radial head dislocated.
For the treatment for Monteggia's fracture and dislocation really depends on the severity and the age of the patient. Most pediatric fractures are managed with a closed reduction and a long arm cast. The long arm cast will be a posterior long arm splint with the elbow in 90 degrees of flexion and full supination in order to prevent the radial head from dislocating again and to keep in the optimal spot for healing. Most adult fractures require open reduction and internal fixation. The closed reduction radial head should be done within 6 to 8 hours of injury and under sedation because it won't be comfortable for the patient. Open or complex fractures will require surgical fixation no matter the age of the patient. And then for surgical and non-surgical cases, radiographs will have to be taken every 2 weeks, and overall 6 weeks is the average time until you can begin rehab exercises. So on the left side here, you'll see the conservative treatment of the long arm cast going past the elbow and the sling in the hand in full supination. On the right side, you'll see the surgical treatment where that ulna now has a plate and screws in it to help heal the fracture, and the radial head has been reduced back to position.